A 5-year-old boy has easy tiredness, irritability, poor concentration, enlarged liver and spleen, and low blood cell counts. He is diagnosed with Gaucher disease. Which enzyme deficiency is responsible for this condition? The right answer is option C, glucocerebrosidase. Gaucher disease is the most common lysosomal storage disorder and is caused by glucocerebrosidase deficiency, leading to lipid accumulation in macrophages. A 7-year-old boy falls from a height and suffers a fracture of the humerus. After the injury, he has difficulty bending his elbow, difficulty turning his forearm upward, and numbness over the outer side of the forearm. Which nerve is most likely injured? The right answer is option B, musculocutaneous nerve. The musculocutaneous nerve supplies the muscle that flexes the elbow and help in supination. It also provides sensation to the lateral side of the forearm. A patient comes with loss of vision. A brain scan shows an aneurysm pressing on the optic chiasma. Which artery is most likely responsible? Here, the right answer is option A, anterior communicating artery. The anterior communicating artery lies just above the optic chiasma. An aneurysm here commonly causes bitemporal hemianopia. A child with acute lymphoblastic leukemia receives radiation therapy before a stem cell transplant. Which type of cell is least affected by radiation? The right answer is option D, neurons. Neurons do not actively divide, making them least sensitive to radiation. Rapidly dividing cells are affected the most. A patient is brought to the emergency room after a road traffic accident. He has left side chest bruising, severe pain in the left upper abdomen, and low blood pressure 90/50 mmHg. What is the best investigation to do first in the emergency room? The right answer is option B, FAST. That is, focused assessment with sonography for trauma is the first investigation in trauma patients with suspected internal bleeding. It is quick, bedside, and detects free fluid. An unvaccinated 2-year-old child has fever, runny nose, red eyes, and bluish white spots inside the mouth. The next day, he develops a red rash starting on the face and neck. What is the nature of the virus causing this illness? The right answer is option C, enveloped single-stranded RNA virus. This child has measles, identified by Koplik spots and a maculopapular rash. The measles virus is an enveloped single-stranded RNA virus. A patient from Uttar Pradesh has fever, pallor, enlarged liver and spleen, and pancytopenia. The Buffet code shows macrophages containing organisms with a kinetoplast. Which insect spreads this disease? Here the right answer is option A, sandfly. These findings suggest visceral leishmaniasis, that is Kala Azar. It is transmitted by the female sandfly, Plebatomus species. A dead body is examined after death. There is a horizontal ligature mark completely encircling the neck below the thyroid cartilage, and no dribbling of saliva is seen. What is the most likely cause of death? Here the right answer is option C, ligature strangulation. A horizontal ligature mark below the thyroid cartilage with no dribbling of saliva is typical of ligature strangulation. A 45-year-old woman is explaining the benefits, risks, and possible complications of a hysterectomy. After understanding everything, she agrees to undergo the surgery. What type of consent is this? Here the right answer is option B, informed consent. Informed consent means the patient understands the procedure, risk, benefits and alternatives before giving permission. A woman with preeclampsia is receiving magnesium sulfate after a cesarean section. She becomes drowsy and confused, has a respiratory rate of 10 per minute, reduced urine output and absent knee reflexes. What is the most likely cause of her condition? Here the right answer is option C, magnesium sulfate toxicity. Absent knee reflexes, respiratory depression and oliguria are classic signs of magnesium sulfate toxicity, especially when the kidneys cannot clear magnesium effectively.